So, good morning, everybody. Today marks 414 days since our first case of COVID-19. We're literally in week 60, believe it or not, and we're still moving forward, but things are getting better. So we got a lot of great announcements, and one of the good things is that we had no one pass away last night, which is good. And to the families that lost loved ones during this, the 375, my condolences and prayers still go out to you. We're getting through it. The light's here at the end of the tunnel. We are almost getting out, and but we still have to do our job. Please still wear your mask, cough into your arm, clean your hands, stay 6 feet apart. And remember, I know the CDC put a lot of new guidance out that you can walk around outside. Just be cautious, and it's actually really helped with the flu season. The flu season's been really down this year, so it does work wearing a mask. And I was saying yesterday, joking around, I go, the masks do have some good benefits because it's kept the flu down, COVID-19 down, and when you go to lunch, you don't have to worry about having food in your teeth anymore, right? Because you can just put the mask back on and no one knows, so which is good. But as of yesterday, we had 53.2% of Albany County's population has received at least the first dose. 40% have been fully vaccinated, and compare that to the statewide first dose vaccination of 45.6%, and the full vaccination rate at 33.4%. Albany County now has administered or reallocated over 497 first and second doses of the vaccine. Alone, we have administered over 36 vaccines to people here in Albany County, and thank you to Dr. Whalen and her team for doing an extraordinary job. Yesterday was the first dose and second dose at the Times Union Center. The second dose was 908. The second dose for the first dose people was 264 people that showed up, and we had 16 walk-ins. So we've been talking about this, we've been going back and forth, and we got to reimagine how we're getting the vaccine out to people, trying to engage that certain population now that has a vaccine hesitation or doesn't want to get the shot. So we're going to be coming up with a lot of different ideas and initiatives. You're seeing things all around the state. People are trying different things. Chicago, I believe, is giving you a voucher for food or for beer. People are, Mark Bowling carts out in Erie County is you get a shot, you get a voucher for a shot at some local bar. There's a variety of things that we're kicking around to see what we can do to engage that, but we're here to announce a few of the new initiatives that we started to talk about as we hit this milestone, not just in Albany County, but throughout the state and throughout the country. We're all having the same issues. And if you look at other parts of the country of where things are going, COVID's still going up. Some hospitals are at 100%. It is better. We're getting through this, so we're not trying to scare anyone, but we just still need to work together in our partnership to get it done. Because whether or not you're a Democrat or Republican, let's put politics aside. We roll up our sleeves and go to work and keep our residents safe. That's the job of all of us. So that's why I'm proud to be sitting here and saying to everyone, please, we're setting up testing sites across the river, throughout the region. It's what we talked about with Steve McLaughlin, Rory Fluman, Steve Bolger from Saratoga, really just working together as a capital region because we're one. There's over 1 million people in this area. There's over, I think now we're up to like 19.8 million people in New York State. We're only going to get through this by working together in a partnership and coming up with creative ideas. And whether we're giving the shots out here or we're helping out Rensselaer or they're helping us out or we're helping out Schenectady, again, every shot in someone's arms is a shot closer to getting rid of the mask and fully getting opened up. We've shared over 4,800 first and second vaccine doses with our neighbors because, again, we care and we want to make sure we all get through this because we are one here in New York State. So the only sad thing I really have to say is Schenectady County pulled ahead of us. Rory Fluman and the chairman, Tony Jaczynski, they've actually just creeped ahead of us. So they're taking the lead for the first dose vaccination right here in the capital region. So congratulations to them. I'm not saying it's competition, but if that's what it takes to get people energized to get out and get the shot, that's what we're going to do. So again, we're always looking for new ways of getting the vaccine out. And right now at 175 Green Street, which was our Department of Health complex where the BOEs now used to be DMV, you can walk in today, Monday and Tuesday from 9 to 3, and you can get the vaccine. You don't need an appointment. You don't need to fill out anything. You could walk in and get it. And please, if you're in the neighborhood or you're driving around and you decide to get the vaccine, show up. Just show up and you'll get the shot. So we're also offering free transportation for seniors over the age of 60. just call our number at 518-447-7198. That's 518-447-7198. If you need assistance, we will pick you up at your house, you or your aide, bring you down to the health complex, get your vaccine, do it in a safe way, and then get you back home. So please, for the people that, just have transportation needs or don't want to take a bus, there's still people, believe it or not, that aren't taking mass transit. That won't get an Uber or Lyft because they just don't want to put themselves in that or get infected. So we're there for you. Another new initiative, and I got to thank CDPHP and Dr. Whalen and her team and our team for, again, trying to come up with ways of partnering with people in the community to get this out, to get it out. So that's why we have Kathy joining us today. She's the Vice President of Community Engagement. And there's a new mobile vaccine van provided by CDPHP. We'll be able to travel throughout the county and the region, not just here, throughout the whole region, to make sure that there's accessible places for people to go to set up on corner, kind of what Dr. Whalen and I did, setting up the COVID-19 testing on the street corners, to have people come up to there and find out and identify where maybe there's an underperforming zip code we can get into and set the van up. But it takes a lot of work working with people, so I do want to thank our county staff and everyone else. And before I talk, I'm going to turn over to Dr. Whalen, but I don't know if you want to say something before I let Kathy say anything or talk about this.
I'm really pleased about this initiative, and I'm very happy to have Kathy Leyden here with us today. This is going to be a great way for us to get vaccine out into the community. I do want to also promote the fact that we will be doing walk-ins at the health department from 9 a.m. to 3 p.m. We are hoping next week to be able to announce that that is going to continue, but for now it is going to be today, Monday, and Tuesday. And for people that are interested in learning more, please come down. We have certified health educators that can speak to people, because I think a lot of people now want to get a little more information. And we know there's a tremendous amount of misinformation in the press right now, and we really need, and on social media, we really need people to get the right information to make an informed decision for them. So if you'd like to come down and just speak to a health educator to better get an idea of what the best decision is for you and your family, we encourage you to do that. We are going to be doing that at any vaccine effort that we have coming up, so that people can get the education and information that they need. We are hearing that a lot of businesses are providing incentives, which I think is a great idea, working towards the goal of having a fully vaccinated workforce is something that will get all of our businesses back up and running faster. So utilizing things like incentives are helpful strategies. And when you come to us, if you need that additional information, we're certainly happy to provide it. So I am very happy to have Kathy here today, and I think we'll turn it over to her now.
Yes, Kathy Leyden from CDPHP, who is the President in Community Engagement. Kathy.
Thank you, Dan, and thank you, Dr. Whalen. Definitely appreciate the opportunity to partner up with the county on this initiative for the mobile clinic. Our first one is today, happening between 10 to 1 at 275 State Street at the Emmanuel Baptist Church. It's also in partnership with a wonderful community organization called Focus Churches of Albany. So we have folks on site there who are ready to talk to community members, provide the facts about the vaccine, and if they are open to it, actually get vaccinated on the spot. So we love this type of mobile, flexible approach, and we hope that this is the first of many opportunities to partner up with the county on these mobile clinics. I also want to commend, on behalf of everybody at CDPHP, we want to commend the County Executive and Dr. Whalen for all their efforts to keep Albany County residents informed throughout this pandemic and for achieving your vaccination rate. Very impressive numbers, so kudos to you all.
Thank you.
You're welcome.
So again, this is about getting into target communities or people that don't want to come out or go to bigger places. As you see, Washington Army numbers are going down. Our bigger pods, we're going to reevaluate what we do on a weekly basis. And this partnership will help us get into the minority communities, rural parts of the county, which we talked about, Queens, Ravenna, the hill towns, that numbers need to get up. So by doing this partnership and getting out there. We're getting more people vaccinated, meaning that, look I'd like to sit here and announce what Mayor de Blasio did yesterday and saying by July 1st, we're going to be fully open 100%. I hope we're going to be there. And the way our numbers were going in the beginning, I thought by the end of April, we would have 100 or be at 70% of the people vaccinated, and then everyone hit that wall. But please, people, do your part, and like Dr. Whalen said, educate yourself, and there's people there to help you. Don't believe everything you're reading. Like I said, go to the secure websites like World Health, CDC, our Department of Health, and a trusted resource to go in to read this. So one of the things I do want to talk about, as of today, we have 23,839 new cases of COVID-19 and to date. 29 positive cases, which is awesome. The numbers continues to go down. Since yesterday, our 5-day average is at 33.2, which is pretty low, and it was 32 the day before that. So we went up a little bit, but it's still low. 17 had out of the 20 new positive cases, 17 had close contact to a positive case. One is a healthcare worker, and 11 don't have a clear source of infection. Some good stuff too. Our Albany County 7-day average percent positive is now down to 1.7%, which has declined from 3% over 10 days ago. So we kind of went up and now we're going back down. Capital Region now stands at 1.6% for its 7-day average, again, which we're getting back down there, and I can't wait till we hit 0 or 4 or 5. There are now 316 active cases in Albany County, one of the lowest times we've had of active cases, which is good. Currently 747 people under mandatory quarantine. Yesterday there were 718. There were 59 recoveries since yesterday, which is good. 3 new hospitalizations overnight. There's 24 people currently in the hospital from the virus. Yesterday it was 24. We stand at the same. So there are 6 patients currently in the ICU, and there are 6 patients in the ICU the day before that. Again, we still plead with everyone, please wear your mask, cough into your arm, clean your hands, 6 feet apart. It has worked. It continues to work, and I know the president put out new guidance. Everyone's saying you don't have to. Just be careful. If you're used to wearing this, just think all the good it's done. And I know not everyone wants to have them on, asthma and everything, and I don't want to get into that whole debate, but please just remember what it has done to get us to this point where we're at, and we're almost there. So please, I urge everyone to wear their mask. I'm happy to hear that the Moderna vaccine has a longer life shelf than they thought. It can now be refrigerated at temperatures up to 3 months, which is awesome. So we didn't know that. I mean, now we're learning new things as we go forward, and it will make it easier to get it out throughout the county, including doctors' offices, which we continue to lobby with the state to let doctors start taking over the vaccines, because we're going to be at that point. People are going to be coming to the bigger pods, and they're not going to be doing walk-ups and this type of, I hate to say it, like family-oriented delivery of the service of getting there, but it's time-consuming. It takes a lot of resources. It takes a lot of people to go out there and to do this in the community, but we're going to do whatever we can to continue to move forward. I'm happy to see the U.S. economy has added, when switching gears a little bit, has added 916,000 jobs in March. This is the largest increase since August of last year, which is a good sign. We're going in the right direction. But one of the things, as I'm bouncing around and I've been doing ribbon cuttings, and businesses are reopening, and as restaurants are getting back to almost 100%, and hotels and everyone else, and business owners are talking to me, they're having a hard time hiring people. I know we've always had the debate at $15 an hour and everything else, and not to get into all that. There's a local restaurant that was offering dishwashers $20, $17, $18, $19, $20 an hour, and they can't hire anyone. I don't want to call out the businesses where I've been at, and they're just like, look, this is great, we're opening, but we can't get people in the workplace. So please, there's a lot of jobs out there. My hat's off to the Albany International Airport. Phil Calderon had a hiring fair was last Friday, I believe, right? Last Friday they did a hiring fair at the airport. There's a lot of jobs. There's a lot of jobs out there, from TSA to the airlines to mechanics, and to the restaurants. So if people want to open and get back to some type of normalcy, we need to get people back to work. So that will be another initiative we'll be pushing. I'm happy to see that the governor has announced the curfew for restaurants and bars will be lifted for outside dining beginning May 17th, which is good, and inside dining 2 weeks later. Certainly the curfew being lifted will help them to, start getting people back into the restaurants. And I know the Senate and Assembly just lifted you don't have to buy food when you sit at the bar, which is all good stuff. But again, as we open up and we get there, we need people to get back to work, and the jobs are there. So as we continue to roll out, I'm hoping soon you're seeing other states fully open up, and I'm just saying, please follow the science. I know we're almost there. I don't want to jump the gun. Again, I would love to do what Mayor de Blasio has done and give a date, but Dr. Whalen and I have learned giving dates don't necessarily work to our timetables, because when you follow the science, sometimes it looks like it's going good, and it could take a left turn on you. So we definitely want to make sure that we give out the right information. One of the other things, I want to thank John McDonald and Pat Fahey for really getting the alcohol to-go sales for the last 2 years, and hopefully continuing that going forward, because it's been a real big booster to restaurants to give out their signature drinks as people pick up orders or they deliver them to their house. And Governor has been extending his executive orders only the last weeks at different times and lifting different things. So again, it's been like this way for 60 weeks, I should say. We hear about it. When you hear about it, we adjust, and we'll continue to adjust at some of the questions that we've gotten. What's going on with the latest executive orders expiring in next week or May 16th. When we get the data and we get it, we'll let you know. And quite honestly, it gets out there pretty quick through the media. So please, bear with us on a lot of that stuff and everything else going forward. Those who want to get the vaccine, you can still, or have any questions, go to the state hotline, 1-833-697-4829. Again, don't forget, you know where you can go to get the vaccines. We're making it easy. 211 United Way, and I was just there for a ribbon cutting. United Way is moving to downtown Albany at the old Kenmore Hotel, which is awesome. They redid it. Nonprofits are going to be in downtown Albany. And it's really going to get everyone working, because people got to realize as we move forward, communicating and letting everyone know what the left and right hand are doing, all these great nonprofits that are going to be together, kind of like an incubator space, is going to be awesome, because it means better services being delivered to the people that need them and being more effective as we deliver services. But that model of people staying hybrid, of the Zoom world that we're in, you're going to see that with a lot of companies. They're not going to come back. They're going to have a model where they work at home, they work in the office a little bit. So it's going to be interesting as we move forward. And again, things have changed, and I know people are used to it now. They're getting used to it, because our mental health hotline that we set up day 2 of this over 60 weeks ago is being used less and less, and that's good. We're going to keep it going to the end, to make sure that if anyone has any questions, or especially your children, I've said this before, please talk to your kids, talk to your brothers, your sisters, your friends, because people deal with mental health issues or issues differently than anyone else. That line's available 7 days a week from 8 a.m. to 5, 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. To Karen Ziegler and their team, extraordinary what they've done in setting up the text, email, so people that are afraid to call because the person abusing them is in the room, we're here for you. We have the support mechanisms throughout the county. During my stay at the county, we're launching some huge initiatives for that. But to her and her team, thank you for what you do to be there for people. Again, it takes a partnership working together, and I can't thank CDPHP enough, and Kathy, for everything that you and your team do, Dr. Bennett, coming up with different ideas to deliver services, to get out there. So, stay tuned. We're going to have more announcements like this and more good stuff, and hopefully our numbers stay down and you don't have to see Dr. Whalen and I for a while after this. So, again, I want to thank everyone for being here, and again for the partnerships, and stay safe out there and wear your mask.